A blessed Sunday, everyone! Welcome to Doctors on TV. It's nice to see you all again today. But before proceeding any further, we would like to invite you mga kasangbahay, don't forget to follow and subscribe on our social media accounts. Please like and follow our Facebook page at www.facebook.com/doctorsontv and like and subscribe to our YouTube channel. Just type www.youtube.com/@UNTV News and Rescue. And you can actually send us questions and comments po sa mga pages na yan. Kaya after liking and subscribing, i-share nyo na din po sa inyong family and mga friends. There are women who seemingly don't have to exert an effort to produce a baby or even babies. But for some women, it is a hard task because infertility enters the frame not just in women but also in men. Speaking of infertility, here are some of the information on how prevalent infertility is in our country. Let's watch this.
Infertility is a growing concern in the Philippines, with around 15% of Filipino couples struggling to conceive, according to a report by the World Health Organization, or WHO, in 2022. It is higher than the global average of 10%. The trend of delayed childbearing is one of the most significant factors contributing to infertility. Many couples focus on their education and careers, which puts them at a higher risk of experiencing infertility. Other factors contributing to infertility in the Philippines include lifestyle habits such as smoking, alcohol consumption, and obesity. Infections, diseases, and genetic disorders can also affect fertility. A lack of access to reproductive health services can prevent couples from seeking help, and some may not be aware of the available treatments. The WHO report recommends that better access to reproductive health services, including family planning and infertility treatments, is necessary to address this issue. Infertility is often associated with social stigma and can be a significant psychological burden for couples.
It's great to know about this dahil infertility can cause emotional damage and financial stress that affect many couples. Kaya naku mga kasangbahay, stay tuned dahil naku lalo na po sa mga couple who are struggling with infertility. We hope that this can help you. But before that, let's take a short break. And yes, we're still here at Doctors on TV. Ito po nga para mas maintindihan po natin ang infertility mga kasangbahay. Let us watch this.
Infertility is the inability to conceive a child after trying for a certain period, usually 1 year or more. It can be caused by various factors that affect the male or female reproductive systems, making it difficult or impossible for them to become pregnant or carry a pregnancy to term.
And now for us to understand more, joining us here is Dr. Eileen M, an obstetrics and gynecology-infertility specialist from Makati Medical Center. Doc Eileen, good morning and welcome to Doctors on TV.
Good morning, Sarah, and good morning to everyone, mga kasambahay.
Yes, and Doktora, buti na sneak in nyo kami sa inyong very busy schedule. And, our topic is really very interesting. And lalo na ako like babae. And then, dami kasi we've been hearing about, yung hardship and challenges po of bearing, 'di ba? Ang hirap. But of course, sabi nga ang kalimitan ang talagang kukumpleto daw sa isang babae ay ang magdala ng anak sa sinapupunan. Okay? And but of course, syempre marami pa rin naman mga ibang factors that doesn't make a woman naman na really incomplete or less of herself pag hindi. But of course, having all these aids especially with the advancement of this technology nowadays, so parang kaya itong maganda na pag-usapan natin. But can you explain more ano po ba yung ibig sabihin ng infertility para mas maintindihan pa po ng ating mga viewers?
Thank you, Sarah. When you say infertility, it's the inability of the couple to achieve pregnancy within 1 year of unprotected intercourse. Ibig sabihin, nagsasama sila, nagsisiping sila na regularly, and yet hindi nagbubuntis, and they're not using any form of contraceptive. So no condoms, no pills, no even natural contraception like withdrawal. Withdrawal is only about 55% effective. So, you know, it's still some form of contraception.
But you know what struck me, Doktora, when you mentioned about actually it's the inability of the couple. So it just means na hindi lang ang enable would be yung babae. So kasama rin dito sa usapan yung guy,
it has
yung
to
lalaki.
be the couple. Oo, it's a 50-50 thing, obviously. So there's a contribution of the male which is very, very important. Eh kung walang similya, miski buwan-buwan nangingitlog yung babae, paano magbubuntis siya?
Yeah,
diba?
And of course, the quality rin ng similya.
Correct.
Kahit na meron pang ample amount, okay? And Dr. usually, ano po yung mga dahilan? What are the causes of infertility?
Well, depends on the population that you're studying, no? So like in the States, it's an equal 50-50 thing. So 50% male, 50% female ang cause. In the Philippines, sa PGH, meron tayong study in about 2016 which said that for Filipinos, 47% was pelvic factor. So ibig sabihin, yung mga endometriosis, pelvic infection, and then 22% would be ovulatory function and 22% tubal factor.
So these are from sa side po ng babae.
Oo,
How
pero
about-
hindi, meron ding male factor na contribution yon. Pero kasi nga, yung lahat-lahat, ang pinaka-common sa atin na done in PGH was those factors, pelvic, tubal, anovulatory, and the rest of it is male factor. And there's even unexplained infertility, which we'll talk about.
Oh, I see. And usually when we talk about these causes, Doktora, I mean, so siguro nagva-vary din dito kung ano yung magiging response sa management later on.
Yeah, of course. The management will depend on what's causing the infertility. So you direct the treatment according to what's causing the inability to achieve pregnancy.
And Doktora, having mentioned different causes of this of infertility, meron bang mga signs na napapakita or are there parang how does a woman who is infertile manifest po? Parang upon seeing the patient in your clinic.
That's a good question kasi generally walang signs, no? Pero ang babae, kung halimbawa hindi siya buwan-buwan nire-regla, more chances are hindi siya nangingitlog. So if you look at her, maybe she's on the obese side or overweight side o kaya tapos balbon siya, nagpipimple siya, medyo oily yung skin. Alam mo, she has what we call polycystic ovary syndrome, which means to say hindi siya regularly nag-ovulate. So women are supposed to ovulate monthly, so that's 12 times a year. Pero when you have polycystic ovary syndrome, maybe you ovulate 3 times, 4 times a year. That will tell you, this woman is not ovulating and chances are she's going to have a hard time getting pregnant. So yun ang sign. But most women, wala kang makikita. They really have to come and see you and they have to be conscious of the fact that if they're not getting pregnant within 1 year of trying, then they should be seeing a doctor.
I see. And what are the usual practices po that can contribute to infertility in both women and men?
That's a very good question kasi yung lifestyle is very important. If you are smoking, if you are taking alcohol, more than the usual amount of alcohol, and also if you're too much stressed in your work, you're not getting enough sleep, you're not getting enough rest, those can give rise to an ovulation. Smoking and alcohol can affect both male and female. So, pwedeng bumaba yung similya, pwedeng bumaba yung motility, even the morphology, pwedeng lahat abnormal, no? So, you only need 4% of your sperm to be normal, and yet, if you're smoking, then that can lead to very abnormal sperms. And for the female, that can actually, smoking can lead to early ovarian failure. So, that's very important.
Grabe pala talagang effect ng mga bad lifestyle practices.
True,
okay.
true,
And okay, Doktora, so sige. Usually po, kunyari guilty talaga yung couple. Either of the couple would be guilty of yung mga bad habits. Okay? And syempre usually naman yung pagkabagong kasal, hindi ba nagpaplano na sila. When is the best time para at least magpa-start na sila na magpa-assess ng sarili na, I mean, should it start pa after 1 year of trying or maganda rin na bago ikasal, you would start preparing yourselves na para at least you can go with your timeline, yung target date mo na parang at least by this time in God's grace, mabubuntis ka na.
That's a very nice question. There are some patients who come to us, doktora, malapit na po aking kasal. Gusto ko lang makita kung meron akong depression. That's a good move, no? I mean, even before you actually embark on getting married and having regular sexual intercourse, it would be nice if something's you want to find out kung may diferensya, no? Sa pangingitlog, sa matres mo, sa kung meron ka endometriosis. However, na in a couple, kung 1 year na nga sila nagsasama at wala nga silang ginagamit ng any form of contraception, yon dapat magpatingin na. But if, like, say, you're more than 35 years old for the woman, and then you have endometriosis, you know that you have irregular menstruation, you've been operated on, you had some form of chemotherapy or radiotherapy for some, cancer, some disease, then you have to see your doctor straight away. You know, 6 months of trying lang, dapat nagpapatingin ka na. For the male, if you have had some surgery or maybe if you had a history of undescended testes when you're a baby, yon, mga ganon, dapat nagpapatingin na. So don't wait anymore kasi a lot of times they come to us too late. Although in this day and age, marami tayong technology to obviate the problems, no? Meron na tayong donor sperm, meron tayong donor eggs, meron tayong surrogacy. But in the Philippines, those are problematic because we are not allowed to use third party. But so, the bottom line is you go see your doctor early. And likewise for the women, to start working on a pregnancy when you're younger, because
yes, Doctora, and you mentioned about surrogacy, which is not actually allowed here in the Philippines, pero siguro para sa kaalaman ng ating mga viewers, surrogacy is when you get a third party to carry
the pregnancy.
Can you expound on that, Doctora?
Okay. So ito yung mga third party ways by which we can get pregnant. So kung halimbawa, we'll start with egg donation. So kung halimbawa wala ka ng functioning ovaries, pwedeng malapit ka na mag-menopause o menopause ka na talaga o kaya na-operahan ka sa ovaries to the point na hindi na nag-work yung ovaries mo. Meron din congenital, meron genetic problems, they have early menopause. Yan. So you'll have to resort to using somebody else's eggs. And then for the sperm, yung may mga lalaki, may azoospermic. Pag sinabing azoospermic, walang sperm. No? Lumalabas either because of obstruction or because hindi sila nagpo-produce ng sperm, then they can use donor sperms. Yung surrogacy naman, ibig sabihin, iba ang magbubuntis sa'yo. Pag paligay mo na, ikaw ay naoperahan dati, natanggalan ka ng matres, o kaya meron kang matres na very problematic, adenomyosis. Adenomyosis is a condition, it's benign, pero pag nagre-regla ka sa muscles ng uterus mo, and it causes the uterus to be very much enlarged. It has poor implantation capacity, so either lagi nakukunan o hindi nagtitake, hindi kumakapit yung embryo, yung mga yung adenomyosis. So if it's very severe, then you're better off, of course, using the uterus of another woman. Sayang, nakaka-produce ka ng eggs, nakaka-produce yung husband mo ng sperm, may embryo na nag-iintay.
Just bury it, no?
And somebody else will just carry the pregnancy for you.
We've been hearing stories like that na sometimes it's even the mom ng babae ang
nag-offer. Meron ng gano'n.
Okay, para at least hindi naman a total stranger yung mag-carry. No? But
Correct.
anyways, so this is just another issue on the side. However, Doktora, ano ba yung chances kasi of getting pregnant with with the technology nowadays? Kasi like na-mention kanina, di ba, may surrogacy. But of course, if you still would want to stick dun sa ikaw yung mag-carry nila, napakatagal ba ng assessment period and management? Usually, on the average, how long does it
You ask me beautiful questions. Anyway, we call that autologous gametes, no? So, sarili mong itlog, sariling similya na lalaki, and sariling embryo. So, siyempre, most couples would want to use their own, no? Of course, we're open to adoption later on anyway, etc. But you want to have your own baby coming from your eggs and your husband's sperm, and coming from your own uterus. First of all, let's put things into perspective. The chance of a normal couple achieving pregnancy, what we call the fecundity rate, is only 20%. Meaning to say, if there's nothing wrong with them, she's ovulating, her tubes are functioning, the uterus is normal, the count is good, nothing wrong with the pelvis and cervix, then the chance of achieving pregnancy is only maximally 20%. No, it's not 100%. So kung nag-contact kayo at the time that you're ovulating, chances are you're gonna get pregnant 20% of the time lang. Okay? So that's for normal couples. Pero kung halimbawa, hindi ka nangingitlog, di syempre kailangan mo nang pangitlogin. So 95% of the time, if it's polycystic ovary syndrome, they will ovulate. But 50% will get pregnant because they will have other reasons why they're not getting pregnant. Maybe there's tubal factor, maybe there's male factor, endometriosis, and all that. Now, you address the problem. No, so if the problem is medyo may male factor, hindi masyadong magalaw yung similya, kakaunti, yan, morphology is not so good. Imagine you only need 4%, no?
Yeah.
Out of 100 sperms, only 4 need to be normal.
Pero yung morphology, di ba?
Yung itsura ng sperm mismo.
Either malaki yung ulo, yung tail maikli.
So kung may diferensya, either hindi siya makaka-fertilize ng egg or kung makaproduce man siya ng embryo, it's an embryo which is not a good embryo, which will not implant or madaling makunan. So, yun. So, kailangan normal din ang morphology.
Right. Ganong katagal usually po yung assessment?
So, a lot depends syempre on the cause. No? So, we talk about cumulative pregnancy rate. So, dapat yan, talagang tinitingnan mo yung patient on a regular basis. As fertility doctors, we don't want the patients to spend so much time between now, the time that they consult, and the time they get pregnant. So, you want to shorten that. So, you focus on the problem. So, if the problem is ovulation, you get her ovulating. But by 3 or 4 cycles, dapat nangingitlog siya, dapat nagbubuntis na siya.
Yeah.
Diba? So, kung hindi pa nagbubuntis, then you have assisted reproduction. So, by that time, siguro gagamit ka na ng insemination. You're gonna bring the sperm directly into the uterine cavity to increase the chances of pregnancy. And you combine that with ovulation induction agents. Kung hindi pa, tinry mo na 3 times, 4 times, maybe at the most 6 times, depending on the age of the woman, then you go to IVF. But in this day and age, pagpaligay mo na, you have severe endometriosis. Talagang both ovaries have cysts and, you know, grabe yung adhesions. Then the count is not so good. You don't try that anymore. You probably will go straight to test your baby na.
Especially, di ba, doktora, kapag the age talaga, no?
Yes, age is an important factor. You know, the cutoff is really 35. Beyond 35, the fertility of a woman drastically goes down already, which is why it's very important to try to get pregnant early because age is the most important factor as far as fertility is concerned.
Yeah, and we've also been hearing stories na sometimes parang laging kalimitan yung babae lang lagi ang nawo-work up, 'di ba? When actually maganda dapat sabay also.
Exactly.
Okay, so syempre of course para magsilang, magkaroon ng baby, kailangan partnership yan between a babae and a lalaki, okay? And the problem is nagkakaroon ng problem na pag by the time na naiayos yung babae, we'll just realize later on na pati pala ang lalaki, okay?
That's so true, Sarah. I literally had a patient before na I was trying to convince her, oh, I need the semen analysis of your husband. Hindi ko nakikita yung husband. Most patients will come to us with the husband and wife, no? But there are patients na yung babae lang, tapos yung lalaki seems so busy and seems to be indifferent. So I was giving her fertility drugs, I was monitoring her, oh, sige, mag-contact na kayo at this time, ganyan-ganyan. Abay, siguro, in a 1-year period, maybe I saw her 3 or 4 times because you don't see you on a regular basis, on a monthly basis. After 1 year, I find out there's no sperm. You know, we wasted 1 whole year. So it shouldn't be allowed.
If only na-comply, din
yes,
pinapunta
it shouldn't be
niya na.
allowed. So, well, that was a long time ago. I don't see those patients anymore. I mean, they really come to us, usually kasi nanggaling na sa ibang doktor eh. So, na-try na yung mga ibang treatments. So, by the time they come to you, they're more directed and they're more focused in trying to get pregnant.
Okay, and doktora, usually po, di ba, yung mga ibang individuals, they would want to try on pills or sabi nila kasi, naku, pag gumamit ka ng different forms of contraception, sometimes it even increases your chances of getting pregnant. How true is that?
Well, that's a myth. No? So, it doesn't. There's no rebound fertility when you stop the pill. Okay? So, that's not true. Of course, if you had irregular menses, and you had polycystic ovary syndrome, the pills would regulate your menstruation, but you will still have anovulatory cycles afterwards. So there's no truth to that rumor. In fact, it's sad because some patients would be taking pills for contraception. Finally, when they get married, they want to have kids. They find out they have problems. No, the tubes are blocked. The sperm count is not good, and they have severe endometriosis, and it's very difficult to get pregnant. I even had a patient who's 35. And she was on the pill, not for contraception, she was on it for 5 years because she had irregular menses. Oh. And by the time she came to me, 6 months married pa lang, I checked her ovarian function, she was already menopausal. So at 35, so you can see those patients. That's why it's very important that you are directed to the right doctor also. Because some patients, they go from one doctor to another, PCOS daw kasi irregular the menstruation, hindi na-diagnose ng mabuti. Yung pala, early menopause na pala. So something could have been done between the time they started having menstruation, maybe the time they lost their menstruation. We could have tried to achieve we could have maybe frozen the eggs if they were still not
During
ready,
that time,
ready to get pregnant, or they could have worked on a pregnancy earlier on.
Yes, and you have to understand that early diagnosis would mean early management. Okay?
That's so true.
And Doctora, so you mentioned that it's actually a myth, no? So what other myths can you share about infertility?
Oh, yeah.
And usually na na-encounter nyo in your practice na, oh, I thought ganito, Doctora, and ganito, yun. And
Yung positioning siguro.
Yeah, the positioning.
Yeah, it's not really that important. You know, I think what's important is the timing. So, yung when to have sexual intercourse, it would have to be just before ovulation. The sperm has to be there, meeting up with the egg, rather than the egg meeting there. Remember that the egg can only stay for 12 to 24 hours, whereas the sperm will survive for 3 to 5 days. So, yun. So positioning is not that important.
How about the age of both partners? Kasi Doktora, di ba, sa babae talaga very critical. How about dun sa lalaki? Kasi they would say na, naku, kahit 80 years old na yan, kaya niya mag-induce ng pregnancy sa kanyang asawa. Okay.
Totoo yan, So, for men, wala naman talagang menopause ang men. May andropause, but that's a hormonal thing, no?
Yeah.
But for men, they can literally produce sperms, and those sperms can fertilize. But studies have shown at age 40, men already have a higher risk of miscarriages, no, if they're involved in a relationship. So, age is a factor as well for men, but more, syempre, for women. Kasi ang women, nauubusan ng itlog. Hindi katulad naman sa sperm, no? The motility may vary, yung morphology, pwedeng nagiging abnormal na as they age, or they might have ejaculatory problems. Pero, basically, men, yes, can achieve pregnancy even in their 70s and 80s.
I see. Okay. And, sige, ito na. Napakaganda na nung naging introduction natin. Ang haba na, napakaganda ng discussion natin with regards to infertility. Well, I guess, diba, we've been hearing about IVF, Doktora. And can you share to our viewers kung what exactly IVF is? And mahirap bang gawin to? Nakakakos ba to ng anxiety dito sa mga pasyente na failed na naman? So, may mga ganyang scenario. Diba? You mentioned about the different causes eh. And of course, kung long-standing na yung problema, yung cause. So, of course, you're not, like, infertility doctors like you, hindi naman kayo magician eh. You're here to assist, of course, with your expertise. But, can you like share some stories about your patients undergoing this procedure?
Okay, thank you, Sarah. Definitely, we're not magicians. We're just instruments of God, no? But IVF is an assisted reproductive technique. So, ibig sabihin, tutulungan mo ng mga itlog yung babae, and then kukunin mo yung sperm na lalaki, you mix the egg with the sperm, or you actually combine you can actually put in you inject the sperm directly into the egg, you produce the embryo, you put the embryo back into the uterus. So it seems so simple, but it's not that simple.
Yeah.
You have to be screened properly, and there will be indications. So you don't do it for everybody. Okay, so patients are actually subjected on a daily basis for 10 to 12 days with injections. We call them gonadotropians. These are medications that will make them produce several eggs. So you don't want to produce one egg. Sayang naman, magastos yun eh. You want to produce mga 12, 15, 20 eggs at the most. And those eggs are going to be fertilized with the husband's sperm. And then once you produce the embryo, you put the embryo back into the uterus. Okay? And so it has to be the right timing. If it's a fresh embryo transfer, so you do it within the cycle that you're doing the ovulation induction, or if it's a frozen embryo transfer, you wait for the patient to have her period, and then you prepare her lining para kakapitan nun ng embryo. So that's a frozen embryo transfer.
I see. And once you've implanted back, okay, the embryo, so how long will be the monitoring phase? Kasi syempre, I'm sure kailangan bantayan yan kung okay, successful ba o
Yes,
hindi.
good question. So 2 weeks roughly. So once you put in the embryo, then in 2 weeks time you do your pregnancy test. And when of course the patient gets pregnant, then we have of course some hormonal support to sustain the pregnancy. Then of course we take care of the pregnancy. If the patient is referred to us, we send the patient back to the doctor that referred. And so the OBGYN who referred will be the one to take care of the baby.
Okay,
I mean the mommy.
Yeah, but sadly, if hindi siya nagtuloy, Doktora, hindi na-sustain yung pregnancy, and you mentioned a while ago na dapat maganda marami yung eggs na mapoproduce. So, will that be another trial again?
Well, depends. So, kung the first time you did your ovulation induction, you have several embryos that you produced, you don't have to do the ovulation induction anymore. Meron ka ng embryos, lalagyan mo na lang yung embryos
Lagay na lang
susunod.
nalagay. And usually, yung time interval, Doktora?
1
From
month
the failed one.
It's okay. You wait 1 month, it's okay. You can start. But you want to find out why there was failure. So if there are some things that you can correct, you correct them along the way. Hindi naman yung lagay ka lang na lagay tapos oo. So you want success.
Yeah, kasi syempre you mentioned about yung nagfe-fail siya, okay? So syempre it can induce anxiety on the part of the couple. And have you experienced seeing patients like this na parang they become so anxious already?
Definitely. Anxiety is the name of the game. These patients are very scared. Most of them have been to several doctors. So unfortunately, sometimes they don't really go to the infertility doctor. So sometimes I'm not saying all, but there are times na nag-waste din ng opportunity, no? So sometimes they come to us, naubusin na ng itlog. So nag-menopause na. When a patient comes to you, they already think, am I going to change the house part into a blue room or a pink room? So they think very highly na, they think their expectations are very high. But I have to go back to that initial fecundity rate, which is only 20%, no? So if both of them are perfectly normal, the chance of achieving pregnancy is 20%. If there's a problem with the male, kung insemination, maybe 15 to 18% chance of pregnancy. If it's IVF, it'll give you a 40 to 60% chance of pregnancy. So you have to tell them this kasi ang expectations nila are very, very high, and you tell them, well, the live birth rate, even in IVF, is 25 to 30%. So it's not 100%. Nevertheless, talagang our job is to try to get them pregnant the soonest possible time. We don't promise them, we don't tell them, for sure, you're gonna have a baby with me. No. We tell them, we're going to do our best, we'll try to find out what's going on, and then we'll treat it along the way. And of course, we advise, you have a good chance naman. Halimbawa, kung hindi lang naman siya nangingitlog, ang dali naman pabuntis noon. So you just give them fertility drugs, and they're gonna get pregnant with the next cycle. Some patients come to see you, they're already about to ovulate. Ayan, sige, mag-contact na lang kayo nito. Ayan, have contact today, tomorrow, the following day. Then I'll give you some luteal support. The following menstruation, hindi na dumating.
So basically, time is the key then talaga. And of course, syempre, di ba, you have to go to the right doctor. No? And ang hirap kasi ngayon kalaban natin ng internet eh. Some patients would really diagnose themselves na lang, and then sila na yung bahala nag-research, and sila na yung nagtitake ng mga medications. Okay? And naku, doktora, this conversation is getting so overwhelming, no? Talagang grabe yung information overload na sinishare nyo sa ating mga viewers. But eto, hold muna po, no? At ito po ipagpapatuloy po natin maya-maya lamang. Kaya naku, mga kasangbahay, marami-rami pa rin po tayong pag-uusapan. Kaya wag po kayong bibitin dahil magbabalik po ang Doctors on TV. And we're back again, mga kasangbahay. At ito nga po, mayroon pong lumapit sa ating programa upang matulungan po sa kanilang problema, tulad po ng infertility. Panoorin po natin upang malaman ang kanilang dahilan sa paglapit dito sa atin.
Bali, kinasal kami noong June 22, 2020. Mismong simula ng pandemic. Nung first
Sa
year,
province.
parang hindi pa tayo masyadong alarming, ganun. Kaya okay pa.
Okay.
Nung nag-second year, kasi yung mga cousins namin, marami ng anak, kami hindi pa nakaka-score kahit isa. Doon na sila nagre-recommend na magpa-check kami sa mga fertility doctor, ganyan. Tapos, nag-try siya magpa-ultrasound sa province. Wala namang nakita yung doktor. Anong sabi?
Okay naman, sabi ng doktor. Sabi nga niya, yung matres ko is healthy naman. Okay lang daw. So, yun. Hindi kami parang hindi kami na-alarm na mag-proceed sa next level ng pagpapatest.
Pero pinagkaiba kasi nun, hindi siya fertility doctor. Bali, hindi siya espesyalista. Hindi lang siya, yung regular na nag-OB-GYN. Pero kung sinabi niya na wala namang problema, so hindi rin namin sineryoso din. Para bang naghintay lang ulit kami, pero parang 1 year na ulit yung nakalipas. So, natutuwa kami kasi nagkaroon kami ng opportunity na malaman dito sa Doctors on TV na meron palang ganitong consultation for infertility. Doon na namin na talagang natanggap na meron nga kami problema siguro na kailangan namin ipacheck. Kaya nung nakapunta kami sa Doctors on TV, dinala kami sa Makati Med, natutuwa kami dahil na-enlighten kami na pareho pala kaming may problema may health condition.
Si Dr. Eileen Manalo.
Oo. Si Dr. Eileen Manalo. Bali,
Kasi ako, ano naman, parang ang lagi ko namang nararamdaman sa katawan ko ever since na dinatnan ako, neregla ako mula nung una pa. Masakit talaga yung puson ko. Sumasakit talaga siya. Pero tolerable naman. Kaya okay lang. Hindi naman siya nag-ano sa akin na parang inisip na ganun kalaki yung problema. Kasi sabi nila, normal lang na sumasakit yung puson pag dinadatnan. Pero nung na-check na kami ni Doc Eileen Manalo dito sa Makati Med, may mga pinatest sa akin para malaman kung may PCOS ba, kung normal yung ovary, normal yung matres, ganun.
Actually, marami tayong sinubukan nun kasi marami nagsadya sa amin na magluto kami ng mga seashells.
Tapos
Kaya
malunggay.
lahat ng malunggay, lahat na ininom namin para lang baka kasi makatulong sa amin.
Magpa-acupuncture.
Oo, ginawa na rin namin yung acupuncture. Ibig sabihin, nandun pa rin yung desire, kagaya ng marami siguro mga mag-asawa na magkaroon ng baby. Actually, biroan namin mag-asawa pag may nakita kami cute na baby. Uwi na ba natin to? Kaya yung mga batang nagkalat na
ipasok mo sa bag.
pasok na namin sa bag. Siguro normal lang talaga na magkaroon ng mangarap na magkaroon ng baby. Kaya very informative nung nakausap namin si Dr. Eileen Manalo dito sa Makati Med kasi nawala yung mga yung parabang mga myth.
What if, ganito.
Nabigyan kami ng basis dahil binigyan kami ng pinalaboratory niya kami. Medyo talaga detalyado yung mga lab test namin kasi lahat chinek niya buti na lang nagpapasalamat kami sa Makati Med. Kung kami lang siguro ordinary couple na gustong malaman yung ganung situation, hindi namin expect na ganung kalaki yung aabutin. Pero very mahalaga yung mga results kasi doon namin nakikita ngayon yung health condition namin na yung nararanasan niyang sakit, hindi pala yun ordinaryong sakit.
Malaking factor pala yun kung bakit hindi mabuo yung baby or kung nabubuo man, nalalaglag daw sabi ni Doc.
Actually nga, napaisip ako doon na nung sinabi niyang very prone siya, yung asawa ko sa miscarriage. So, siguro may wisdom ang Diyos doon kung bakit hindi niya kami, kasi 3 years na kami, kung magka-baby kami, tapos andun yung gastos, tapos yung sakit na loob kung makunan siya. Siguro siguro sa maraming mag-asawa, magandang malaman natin yung condition natin. Tas matutunan natin kung ano yung reason behind doon para hindi tayo mahuwi sa haka-haka. Saka mas mapapamahal ka rin sa asawa mo kasi isipin mo kung magkaroon din kayo ng meron talagang mga dahilan na hindi natin nalalaman. Pero alam natin na may pagmamahal pa rin ng Diyos sa atin yan.
Ako, sa akin, una-una mag-diet. Nasa 10 to 20 pounds ang dapat ma-lose weight sa akin. Tapos...
Pero yung exercise niya napupunta sa akin, kaya kailangan 2 kami pala dapat mag-diet. Hindi yung binibigay niya yung kalahati niya sa akin kasi ako naman na napupuruan. So dahil prone kami sa diabetes dahil yung both parents namin may lahi ng diabetes. So isa yun sa factor pala. Actually, pinagbawal niya kaming magkape. Ako naamoy ko pala yung kape. So, maraming actually very informative yung sinabi niya about sa lifestyle na babaguhin mo. Sa pag-iwas ng fatty foods, pagtulog ng maaga. So, kung wala namang masyadong pagpupuyatan, pati stress. So, pala lahat ng factors matutuklasan ng mag-asawa para ma-correct yung lifestyle nila pag nakarinig ka talaga ng nakapagkonsulta ka sa specialista.
Okay, so doktor, sa case po ito ng mag-asawa na ito, so syempre hindi biro ang 3 taon ng pag-iintay. Okay, so ano po exactly yung pinaka-problema sa kanila? Sa babae po ba or sa lalaki or both?
Okay, initially kasi she's 33 and yung husband niya 43, no? So I thought na, well, medyo on the big side siya, medyo overweight siya. So inisip ko pati na irregular menstruation, baka polycystic ovary syndrome. So sa examination, normal naman. Pero nung chinek ko yung ovarian function niya, nakita ko yung sa hormones niya, she is pre-diabetic. Okay? Tapos, at the same time, her ovarian function, hindi na ganun kaganda. So meron tayong tinatawag na anti-Müllerian hormone na normal is 1.3 to 4 nanograms per ml. Yung sa kanya mababa, mas mababa doon. And you don't expect that in a 33-year-old. So, medyo dapat mabilis na, kumbaga, I should try to get her pregnant as soon as possible time.
So, we're running out of time.
We're running out of time. Tapos, meron din tayong male factor. So, nung tinignan ko yung similya, hindi rin ganong kaganda yung similya niya. So, mababa yung count. Tapos, yung, dapat out of 100 sperm cells, 4 dapat ang normal. Yung sa kanya, 2 lang. So, dapat talaga, well, the minimum that we have to do is insemination. Kasi gusto natin i-fast track.
Insemination yung minention nyo kanina na ina-assist, no?
Kunin natin yung similya niya, ipaprocess yun, so you get the most motile sperms. And so, ilalagay mo na yun sa loob. Ang problema, hindi mo ma-check kung normal ba yung sperms o hindi, just the motile sperm. So, talagang ideally, dapat test your baby na nga in order to fast track, no? It's just that kung hindi nila kaya, then you're going to try mga 2 to 3 months of insemination and then you proceed with IVF. Because as I said, time is of the essence. So, kailangan mapabuntis natin sila as soon as possible.
Okay, so ano na po yung, bukod po dun sa mga na-mention nyo na results, okay, what other tests did you request for? And kamusta po yung resulta?
Okay, so aside from a good history and physical examination, you need to do pap smear, mention natin yung semen analysis. So kung may mga hormonal problems, you want to check which hormones are abnormal. Okay? And also, important yung fallopian tube. So, it's important to find out na at least one tube is okay. We do the sono or the hysterosalpingogram. So, si Mrs. gagawa natin ng hysterogram tomorrow. No? Para malaman. It's done mga day 5 to day 10 of the cycle to find out kung the tubes are okay. Kasi you cannot do insemination kung the tubes are blocked.
Yeah.
So, you have to go straight to test your baby pagka ganon. So, yun. And then, of course, you try to get them you give the fertility drugs, you time the intercourse, or in this case, we're gonna do insemination.
Yeah. But how about sa end ng lalaki? Usually, kamusta, nai-improve pa rin po ba yung semen nila, yung seminilya?
Oo.
O semilia rather?
Oo, depende. Kaya nga, the timing is very important. So, pagka nag-check tayo ng semilia, there has to be abstinence of 2 to 3 days before they go for the test. And then, so depending on the problem, so we check their hormones as well. We also look, di ba, sinabi natin yung lifestyle factors. So, kung halimbawa, he's a smoker, he's an excessive drinker, yon, kailangan i-correct natin yun. We also give antioxidants. So, we try to improve the male part of it through treatment. Kung halimbawa, diabetic, i-control mo yung blood sugar, the hypertensive, control yung blood pressure, and so on. So, make them as fit as possible to produce the best sperms possible. Pero kung hindi kaya, then assisted na ang kailangan. So, kailangan insemination or kung talagang mas grabe yung condition, then test your baby na nga.
I see. And usually, this diagnostic procedures po na ginagawa. And of course, di ba, from time to time, may kailangang ulitin. Pero katagal usually na tinatake to?
Well, it really depends on the problem. Some problems only show pagka nagsisimula ka ng treatment. Like mga endometrial polyps, yung pala nagpapakita pagka minomonitor mo na yung lining ng uterus. O yun, pag nakita mo yun at hindi pa nagbubuntis, tanggalin mo yun sa susunod. So, again, it's a case-to-case thing. Some patients will get pregnant immediately. Some patients will take a longer time. Like, if you're just talking about ovulation, in 6 months, dapat 60% dapat nagbuntis na. Actually, majority would have gotten pregnant by the time.
Ako, so sana pala itong ating cases po ngayon, tinutulungan natin. Dapat meron pala tayong follow-up na episode.
Okay,
so
we'll try to find out.
Yes, okay. And we'll just document lahat kung paano naging monitoring, ganyan.
Correct.
Okay, and
i-document natin lahat.
yes, and of course, you mentioned about like itatry yung 2 or 3 na intrauterine insemination. So, pag hindi, well, God willing, okay, sana kung mag-IVF, kasi medyo mabigat nga ang IVF,
So,
and pero sana maging successful, okay? And Naku, titingnan natin ano nga po ba yung mangyayari dito sa ating tinutulungan na mag-asawa, no? And, doktora, siguro, ito yung mga resulta na nandito. Ito na po ba yung mga na-mention kanina? Okay, so you mentioned kanina na yung babae po ay pre-diabetic, right?
Correct. So,
Okay,
syempre,
isa pa yun siya,
so weight
i-correct.
loss is very important. So, sinasabi namin, you have to achieve 5 to 10% weight loss. So, yun lang. Yung 5% or 10% weight loss, kaya yan through diet and exercise. And then, we also give kung we give insulin sensitizing drugs like metformin. May gamot din tayong binibigay to help them lose the weight and also to make them, to control their blood sugar. So, yun, very important. Kasi otherwise, either hindi sila magre-respond sa fertility drugs or they don't produce good quality eggs. And so, mas madaling makunan pagka ganon.
I see. Okay, so talagang itong time pala na to, very critical. Kailangan talagang inaalagaan din nila yung sarili in the same manner na inaalagaan nyo siya lang.
And I always tell the couple na for you to produce a good baby, a healthy baby, you have to have good sperms and good eggs. And so you have to be healthy also. Kaya dapat nag-exercise din sila. They should have good sleep. Sabi nga natin, hindi naninigarilya at umiinom ng alak. Kung pwede nga, bawasan din ang coffee intake nila. So,
Okay, so naku, doktora, ganyan talaga yung ka-importante yung lifestyle, no? And gusto ko yung sinabi niyo, doktora, no, na kailangan talaga pinaghahandaan. Okay. I remember, if I may share lang sa ating mga viewers, no, nung gusto ko nang magbubuntis ako, ay nagpakabait ako ng doktora, talagang healthy diet, ganyan. Well, hindi ako ma-exercise na tao, but of course, if I could avoid yung mga paggamit ng elevator, at least man lang yung sa stairs yung ginagamit ko.
But exercise is very important talaga.
I know, kaya lang I'm
Pero
guilty.
ang sinasabi natin doon, mild to moderate exercise. You cannot have strenuous exercise. So that's also not advocated. Gusto natin, nag-exercise sila, pero huwag namang strenuous masyado. Kasi nga, pwedeng hindi siya mag-ovulate sa babae, tapos pwedeng maka-affect sa
Kasi sinasabi,
sperm.
over-exercising can actually stimulate inflammatory conditions in the body din, ganyan. And yun nga, tapos so, it will all boil down to, if parang sabi nila, failing to prepare is preparing to fail.
Wow.
And yan ang aking favorite na motto, doktora. And of course, this I think is applicable also dito sa case ng ating pasyente po, no?
That's true.
And siguro sa ating mga viewers na nagpaplano, naku, magkaroon ng chikiting soon. Okay? So, pagdadasal din natin. Of course, with all the prayers on the side din, di ba? Kailangan natin yan. Naku, thank you, doktora, for sharing all these insights. Na very generous po yung inputs nyo. And especially dito sa diagnostic procedures po para sa infertility. Naku, kaya makasambahay. I'm sure marami po kayong natutunan, no? Kaya wag po kayong bibitiw dahil magbabalik po ang Doctors on TV. And yun nga, doktora, thank you very much. Napakarami naming natutunan. And actually, ako parang feeling ko, gusto ko nga tuloy mabuntis. Hindi kasi, parang it's very inviting and, there's so much hope na naibigay nyo sa ating mga viewers. And syempre sa may mga problema po dyan, huwag tayong mawala ng pag-asa. Of course, at kailan talagang sinabi ni doktora, it's very essential po yung time, no? Kaya medyo habulin din natin. Of course, lagi tayo din magdarasal, no? Kailangan din natin yan. Kasi if yan talaga yung para sa atin, mangyayari naman, di ba, doktora? And siguro with that, can you give some final words po para sa ating mga viewers, doktora?
Thank you, Sarah. It's really nice to be here kasi ang mga pasyente natin shouldn't take too long para magpatingin. So we fertility doctors, there are about 140 of us in the Philippine Society of Reproductive Medicine who are here to help you. Now, we have fertility doctors in Makati Med. So, ang sa amin kasi, wag na mag-iintay ng matagal. First of all, sa mga babae, don't take too long in trying to get pregnant, no? Don't take too long in getting married and having children. Career is important, but remember, time is of the essence. So, dapat talaga, work on the pregnancy agad. Tapos yun na nga, kung halimbawa, kinasal na kayo, don't wait too long. Mga 2 years, 3 years, dapat 1 year pa nga lang nagpapatingin na. So, thank you for having me here, and hopefully we can help our patient and then we'll monitor kung yung pagbubuntis nila and all, no? So thank you so much, and good morning to everyone.
And thank you again, doktora, and it's so much pleasure having you here, no? Napakagaling niyo, doktora. And of course, sa ating mga kasambahay na may mga fertility issues po, go look for Dr. Eileen Manalo. And of course, Dr. thank you once again, Dr. Eileen Manalo, an obstetrics and gynecology-infertility specialist from Makati Medical Center. We hope that our patient and viewers as well understand the different treatment options available to them and are able to make informed decisions about their reproductive health. So for now, let's just pause for a short break. Doctors on TV will be right back. That's all for today, mga kasangbahay. Maraming salamat sa inyo for tuning in. We hope you found this episode very informative. We'll see you next time, God willing. And of course, binabati ko muna ang aking mga chikiting, si Iya, si Iyo, and si EJ. And of course, hi to Doc Elaine, and I miss and love you both, nanay and tatay. Muli po, maraming salamat sa inyong lahat. Ito po si Dr. Sarah Barba-Cabodil. Let's make it a habit to learn about good health, only here at Doctors on TV.
We would like to thank Makati Medical Center, a hospital with a heart, located at Amarsolo Street, Legazpi Village, Makati City. You may contact them at 632-8888-8999. Like and follow their Facebook page at I Am Makati Med, or you can visit their website at www.makatimed.net.ph. Makati Med Wellness Center, located at 7th floor Ayala North Exchange Tower 1, Legazpi Village, Makati City. Mestiza soaps. Mestiza soaps are made with natural ingredients and a combination of vegetable and fruit extracts, which can be also used by children and pregnant women. Good news is that these beauty products are vegan and cruelty-free. For inquiries and orders, contact 0969-175-4231-33 or 02-8824-5217 or 02-881-30320. Organic acai. Support your health with a 100% organic superfood supplement, Organic Acai Premium Blend, and acai freeze-dried capsules. Rich in powerful antioxidants, fiber, amino acids, vitamin C, omega fats, and other essential nutrients the body needs to help build stronger immunity against illnesses and help increase your energy. Organic acai is available in all Mercury drugstores and other leading drugstores and supermarkets nationwide. Lindis and Gas Corporation, located at 179 National Road, Landayan, San Pedro, Laguna 4023. For inquiries, you may contact them at 02-8824-0867 or 02-824-9360, or you can email them at lgcsalesco@gmail.com. And of course, salamat sa ating partner, ang DepEd Santa Rosa, sa pakikiisa sa ating atikain na maibahagi ang kaalamang pangkalusugan. Clinica Figura. You may contact them at 0917-317-7272. Medical Depot. Healthy Nom Nom Food. Barba-Cabodil Holistic Health Group, located at Unit 1531, Centurion Medical Makati, Century City, Makati. You may contact 0917-317-7272 for appointments and other inquiries about your health and wellness needs. Please like and follow Facebook page, Dr. Sarah Barba-Cabodil. Special thanks to Dr. Gia Grace B. Sison, Head of Makati Med Wellness Center, Attorney Pilar Nenuga P. Almira, President and CEO, Dr. Saturnino P. Javier, Medical Director, Ms. Arlene L. Sonco, Senior Vice President, Ms. Monica Reyes Dizon, Assistant Vice President, Mr. Mark Funelas, Unit Head Manager, Communications and Special Projects.